Now, health officials have called for vigilance as cases of influenza increase in the country. The National Institute for Communicable Diseases warned the Department of Health of the rise at the beginning of May. Now, community members, though, have been asked not to panic. Let's speak to Cheryl Cohen from the National Institute for Communicable Diseases. She joins us now virtually. Cheryl, thank you so much for your time. Just firstly, I think a lot of us have noticed that not only are the numbers of people getting flu increasing, it's also how long the flu is lasting. Should that be a concern?
Yeah, so I think you're absolutely right. We really are in the flu season, and the circulation of influenza is at high levels. I think the important thing to note is that colds and flu can be caused by a lot of different viruses, and what we're seeing right now is the influenza season. So most of the people who have flu symptoms, fever, cough, are actually infected with influenza, and we know that compared to the other cold and flu viruses, influenza actually causes a more severe illness. That's why we vaccinate against it, and that's why we're concerned. So it probably, the reason people who get colds and flu are saying, sure, I'm really sick, sicker than I normally am, that's because they have actual influenza, and that commonly does cause a more severe illness with body pains and fever, and you really feel much sicker, like you really can't get out of bed often.
Maybe the other reason that we're panicking is because of what we experienced 2 years ago. These are symptoms that are very similar to COVID-19.
Absolutely. And I think, there is an increased awareness. Also, it's possible that part of the reason why we are seeing such a high flu season this year could be because of the reduced circulation of respiratory viruses the last few years. Right now, the season is within the range of what we see in normal seasons, but it is on the high level, and it is still increasing. So I think, part of it could be, in fact, that some of us don't have quite as much immunity as we would normally have, because we haven't seen colds and flu before.
And of course, I remember during the months of COVID-19, a lot of people's arguments, even scientists themselves, was that even influenza can cause death. And therefore, it's just that COVID-19 was at a much faster pace or more rapidly. So what advice can you give those of us who don't want to get influenza? Should we continue with all the advice that we receive from people like you during COVID times?
Yeah, so I think you highlight a really important point. Influenza, similar to COVID, can be a very severe illness. Many cases will be mild, but particularly those at high risk of severe disease. And by that, it's very similar to COVID. It's older people, it's people with underlying heart disease, lung disease, people living with HIV, also pregnant women. All of these groups actually have an increased risk of, if they catch the flu, going on to more severe disease and even ending up in hospital or even dying, similar to COVID. And you're absolutely right. The ways to prevent yourself from getting the flu are very similar to COVID. Avoid large gatherings indoors. You can wear a mask. And really also to highlight that there is a vaccine against influenza. And people in those risk groups that I mentioned should really be getting that influenza vaccine every year, because it's the best way to protect yourself. And the vaccine is still available right now. It's obviously, flu is already circulating, but given that we expect flu to circulate for quite a few weeks more, it's really not too late to get the vaccine, especially if you're at high risk of severe disease.
How much danger is a patient in who, for instance, had COVID-19, their lungs, for instance, which is what was mostly affected, the entire chest area? If you did have COVID-19 during the bad days and now you have influenza, how much danger are you in terms of your immunity being strong?
Yeah, so what you're talking about is a possible interaction between COVID and influenza. In other words, that maybe people who've had COVID have more severe flu. The data on that are really limited. A lot of people have tried to study it, but there's not really convincing evidence that if you had COVID, you're going to get worse flu. Of course, as I mentioned, the people who are at risk of severe COVID, like older people or people with underlying illness, are the same people at risk of severe flu. So if you had one of those conditions, you're at risk of both. But there's no evidence really that there's an interaction between the two in any way other than these common underlying risk factors.
So it's a normal thing to be sick of influenza, and maybe also the other thing is the seriousness of it, Cheryl. Sometimes you just get that little flu and you still insist on going to work, or you insist on your child going to school because you're thinking, it's just the flu, it'll just pass. Maybe we should take seriously just staying at home to heal and not spread it.
Yeah, I mean, the most important reason really to stay home, and of course that's a way not so much to protect yourself, but to protect others, right? If you have symptoms of influenza or respiratory disease, if you're coughing and sneezing, you really should stay home until you feel better, to prevent spreading on to others. Also, particularly with influenza, if you have flu, you really shouldn't exercise. There are rare situations where when you exercise with flu, it can actually affect the heart and cause more severe complications. So I think that the best thing really is, if you do have colds and flu, is stay home for those few days, keep warm until you're feeling better, and then you can go back to work or school.
All right, my last question, just very quickly. I have a friend of mine whose husband has had the flu for 3 weeks. Is that normal? What is he not doing?
Yeah, so influenza itself shouldn't be lasting 3 weeks. It's a relatively short-lived infection, very sudden onset, and it usually lasts a few days. But of course, as with all colds and flu, you can get complications. So sometimes you have the initial flu, but then you might have infection, an ear infection or a sinus infection or a lung infection that keeps on going. And if you do have those kind of complications, it's important to go to a clinic or see your doctor, just for them to check it out, because you might need other treatments. For example, bacteria can cause those other infections because you're made vulnerable by the flu, and those bacterial infections might need antibiotics or other types of treatment. So flu itself is really short-lived, but it's very common after the flu to have these symptoms going on because it's weakened other parts of your respiratory system.
Well, Cheryl, thank you very much for your time and for sharing your tips with us as well. That is Cheryl Cohen from the National Institute for Communicable Diseases.